There was this decision. It was a Friday afternoon. There was this decision that something was going to be done, right, about AIDS and HIV and people of color.
I was working in a lot of soup kitchen, food pantry kind of operations, and we started to notice that there were men showing up who looked very sick, in need of food, and obviously and homeless, and they would come at the very end of the serving time because they didn't want to be subject to criticism or other things. We approached the Trinity Lutheran Church, who had room in their basement. So we started doing a simple program of a meal and whatever other recreation or just hanging out.
It was born out of love. It was born out of the need that people saw in the community for people just to be supported. They were literally dying in the streets, and their friends, family, support systems had abandoned them. They had nowhere else to go.
A lot of people, that were HIV positive happen to live in the community. You need these services here too.
If you could just imagine a place where you leave, say, a shelter, you leave a house where you're not really welcomed, and you walk into a place where you smell food that you recognize, you hear music that you love, and then there's somebody greeting you and making you feel like you're at home. But this is your first time walking in.
The AIDS epidemic, as I said, sort of exacerbated pre-existing conditions in terms of homelessness, hunger, poverty, education, everything down the line.
Our members came with so many labels. What we said was, leave all those labels at the door and come in, human to human, eye to eye, and let's work together to get you better.
We started to learn about what it means to be in a struggle for a long time. And some conversations started about what can we do about housing for people with AIDS. And that's, I think, how we transitioned from what we were calling the Upper Room AIDS Ministry to Harlem United.
We're going to make sure we have a place for people living with AIDS and HIV in Harlem. We're going to make sure that they get the care that they need. And so from that basement, there became a lot of ideas about we could provide housing.
Housing really is the linchpin. It's the beginning of the whole path to wellness.
If people are housed, they're more apt to take their medications. It allows the case managers to deal with the other issues he or she may have.
We got our first 60 individuals a place to live. And from there, we kept adding on additional services, primary care and dental, to our services. And those both have expanded over time. Mental health services as well, and then more substance use treatment services.
The one-stop shop idea of healthcare, it was just crystallized for me here at Harlem United.
Harlem United continues to provide supportive services, and even not only the people that was HIV positive, but for people that's not HIV positive.
We were kind of like the trendsetters. We were the change agents. We were saying we're bigger than just AIDS and HIV, and AIDS and HIV won't beat our community. We became able to take care of the total person. On the housing front, we know that there has been a lot of displacement, and then every open slither of land, now has a condominium on it.
As the community is changing, more and more people in the community need to be educated about the services that we provide and how we are a help to the community.
I'm sure that Harlem United will continue to make access to healthcare available to every Harlemite that wants it.
We knew we needed to add another primary care or another health center. In November of 2015, we opened the Nest. We really want to be able to expand the programs that will allow us to get to ending the AIDS epidemic by 2020.
It's really about what the community is grappling with. It's really about what our neighbors are struggling with. And I think that that's what Harlem is all about. Saving ourselves, like figuring out what's not working right, figuring out how to fix it, and then just committing to get it done.